What do you know about hypertension? Often termed the silent killer, hypertension is a long-term medical condition that's more common than you might think. It's characterized by persistently elevated blood pressure in the arteries. Imagine a garden hose. When the water pressure is too high, it strains the hose, right? Similarly, when the blood pressure is too high, it strains the arteries, the vital pathways that carry blood from your heart to the rest of your body. Over time, this pressure can cause damage that leads to serious health problems. But what's considered high? Well, typically, blood pressure readings above 130 over 80 millimeters of mercury are considered high. It's important to remember, though, that hypertension often shows no symptoms, making regular checkups key to early detection. So, let's dive deeper into the world of hypertension. Understanding hypertension begins with grasping this basic definition. Did you know hypertension comes in different types? Yes, the world of blood pressure isn't as straightforward as it might seem. We're dealing with two main types of hypertension here: primary and secondary. Primary hypertension, also known as essential hypertension, is the most common type. It's a bit of a mystery as it tends to develop gradually over time without a clear cause. Think of it as a sneaky, silent troublemaker that creeps up on you. It's like a ticking time bomb, quietly increasing your risk for heart disease and stroke. On the other hand, secondary hypertension is a more direct breed. It's the result of an underlying condition such as kidney disease or hormonal disorders. It appears suddenly and causes higher blood pressure levels than primary hypertension. It's like an alarm bell, signaling that there's a deeper issue at play. Knowing the type of hypertension can help in determining the right course of action. After all, effective treatment begins with understanding the enemy. What are the signs that someone might have hypertension? Let's delve into that question. Hypertension, often called high blood pressure, can be insidious, creeping up without clear symptoms. However, when it reaches a severe or life-threatening stage, 5 common symptoms may manifest. First, headaches. These aren't your everyday headaches. They can be severe and persistent, often described as a pounding sensation in the head. Next, shortness of breath. This symptom can be particularly noticeable during physical activities, leaving individuals feeling winded with minimal exertion. Thirdly, nosebleeds. While not as common, unexplained and recurrent nosebleeds can be a sign of severe hypertension. The fourth symptom is flushing or an unusual redness in the face. This can occur spontaneously without any identifiable trigger. Lastly, dizziness. This isn't your typical lightheadedness. It can be accompanied by an unsteady gait and a feeling of instability. Early detection is crucial, but remember, hypertension is often a silent killer with no clear symptoms. What causes hypertension? Let's unravel this together. First off, obesity is a significant factor. As body weight increases, so does the need for blood to supply oxygen and nutrients to your body. This increased demand leads to higher pressure on your artery walls, triggering hypertension. Next, a lack of physical activity makes your heart work harder. This causes your arteries to tighten, leading to high blood pressure. Third, tobacco use. Not only does it damage your artery walls, but the chemicals in tobacco can also narrow your arteries, leading to hypertension. The fourth cause is an excessive intake of salt. Too much salt in your diet can cause your body to retain fluid, which increases blood pressure. Lastly, excessive alcohol consumption. Over time, heavy drinking can damage your heart. This can lead to hypertension, among other health issues. Identifying these causes can help in preventing and managing hypertension, so let's take steps towards understanding better for a healthier tomorrow. What happens if hypertension goes unchecked? Well, let's dive into it. When untreated, hypertension may lead to a myriad of serious health complications. First in line is a heart attack. Hypertension can cause hardening and thickening of the arteries, paving the way for a heart attack. Then, we have stroke. High blood pressure damages arteries that can become blocked and prevent blood from getting to the brain, leading to strokes. Thirdly, there's heart failure. When the heart can't pump enough blood to meet the body's needs, it starts to fail, and hypertension is often the culprit. Next is kidney disease. Hypertension can narrow and harden the arteries around the kidneys. Over time, this can cause the kidneys to function less effectively. Lastly, let's talk about vision loss. Hypertension can strain the vessels in the eyes, leading to vision problems and, in severe cases, blindness. These complications underline the importance of managing hypertension effectively. How can we prevent hypertension? Let's dive into 5 effective measures. First up, maintaining a healthy weight. It's no secret that excess weight can lead to numerous health issues, hypertension being one of them. So, keeping those pounds in check is crucial. Next, regular exercise. It's not just about looking good, but feeling good too. Physical activity can help regulate blood pressure and prevent hypertension. Third, a balanced diet. Incorporating a variety of fruits, vegetables, lean proteins, and whole grains into your meals can work wonders for your health and keep hypertension at bay. Fourth, limit alcohol. While the occasional glass of wine may not hurt, excessive drinking can lead to hypertension. Last, but certainly not least, avoid tobacco. The chemicals in tobacco can damage your blood vessels and lead to hypertension. Prevention is better than cure, especially when it comes to hypertension. So let's all take these measures to heart and lead healthier lives. How can we treat hypertension? This question is crucial, and the good news is we have multiple strategies to combat this condition. Let's delve into 5 key treatment options. Firstly, lifestyle changes can have a significant impact. Regular physical activity, such as 30 minutes of moderate intensity exercise on most days, can lower your blood pressure by about 5 to 8 millimeters of mercury. Weight loss also plays a vital role. For every 2 pounds you lose, you could see a 1 millimeter of mercury drop in blood pressure. Secondly, medication can be a game changer. There are various classes of drugs such as diuretics, beta blockers, and ACE inhibitors, each with their unique mechanisms to lower blood pressure. It's important to remember that medication should be tailored to the individual, considering their overall health, age, and possible side effects. Thirdly, managing stress is crucial. Chronic stress may contribute to hypertension, so finding healthy ways to cope can be beneficial. This could involve relaxation exercises, meditation, or even seeking counseling. Fourthly, regular checkups are paramount. Monitoring your blood pressure at home and regular checkups with your healthcare provider ensures you stay on top of your health, helping to adjust treatments as necessary. Lastly, dietary changes can make a world of difference. The DASH diet, which stands for Dietary Approaches to Stop Hypertension, is often recommended. This diet emphasizes fruits, vegetables, whole grains, and lean proteins, while limiting saturated fat and sodium. Each of these treatment options offers a different approach to managing hypertension. And often, it's a combination of these strategies that proves most effective. It's important to remember that what works best will depend on the individual's circumstances, medical history, and lifestyle. This brings us to the importance of personalized treatment plans. Each person is unique, and so is their hypertension. Therefore, treatment plans should be tailored to meet the specific needs of each individual, taking into account their lifestyle preferences and overall health. With the right treatment, hypertension can be managed effectively. Remember, the goal is not just to treat hypertension, but to improve overall health and quality of life. Let's quickly recap what we've learned about hypertension. It's a persistent elevation in blood pressure and comes in 2 main types: primary, with no identifiable cause, and secondary, resulting from an underlying condition. The symptoms can be elusive, often going unnoticed, until the pressure takes a toll on the body. Fatigue, severe headaches, chest pain, irregular heartbeat, and vision problems are the red flags to watch out for. The causes are multifaceted, ranging from genetic factors, obesity, stress, excessive salt intake, to chronic kidney disease. The complications of untreated hypertension are severe, including heart disease, stroke, kidney damage, and mental decline. Prevention is always better than cure. Healthy lifestyle choices like regular exercise, a balanced diet, moderating alcohol, reducing salt intake, and quitting smoking can significantly lower the risk. Treatment involves medication, lifestyle adjustments, or a combination of both, tailored to each individual's needs. Remember, hypertension might be common, but that doesn't mean it should be taken lightly. Stay informed, stay healthy.